Hi, I'm Tim Wiedrich, Section Chief of the Health Resources and Response Section with the North Dakota Department of Health. And this special edition of a briefing for the hospitals is regarding COVID response, and specifically some of the pharmaceutical therapies that have become available that are on allocation and that were part of the process for doing the distribution of those monoclonal antibodies and antivirals, not just what we've seen in short supply earlier, but also some of the newer products that are coming online as well. And so as we've walked through kind of the strategy about how this is occurring, as new products been introduced, the initial launch amounts have been so small that it's not been possible for us to have wide distribution. But as we see with many of those products, increased production runs occurring, we'll be building more and more people, more and more organizations that will be able to do the distribution. And so we started with 10 hospitals initially for those small amounts, and now we're beginning to expand into the remainder of the hospitals, which is this group, and for some of the product we'll also be expanding into other entities like the federally qualified clinics and the pharmaceutical concerns, or the pharmacies within the state as well. So more about that to come, but right now I want to, for the actual content, turn it over to George Gerhardt, who has the lead responsibility for this program. George?
Hi, good morning, or good afternoon, everybody. I know it's right after lunch, so we'll try to keep this short so we don't put anybody to sleep. We're going to talk to you today about the HPOP program that you all got invitations to register for, and kind of go through some information about what it is, what it's going to be used for, how it's going to affect everybody, and then how to use it here in a bit. So we'll go ahead to here. HPOP is an ordering portal. It's similar or the same as what the VPOP was, if you're familiar with that, that was used to order vaccines. It's going to be used right now to order the antivirals and the Evusheld, which is a new monoclonal antibody. The old monoclonal antibodies will still be done the same way, but for right now, we'll be allocating the antivirals and that through this program. Okay, one of the terms that we use is a partner or central partner. That's the state entity. We're the control. We control the allocations in the system. Once we know what the allocation is, we order it and then send it out to the different various places. At this time, we bring all the product to the North Dakota warehouse, and then from there we send it out to the locals to where it's allocated to. But at this time, later on, we'll be sending it directly to you as our allocation increases and we're able to meet the minimum orders. Provider is you guys, an individual site of care. So like a doctor's office, a hospital, a pharmacy, they're the ones that actually receive the therapeutics and use them. The providers are managed by the partners, which is us. In the state here, we have a partner portal, and then we have a provider portal for our warehouse. And I'll show you both of those here in the coming up. A contact is an individual HPOP user, so like each one of you is a contact inside that. Contacts can be added by the providers themselves, and I'll show you how to do that in the deal, or partners can disable that feature so you can't add them. But we leave that open so you can add people into your own portal, and it'll automatically send out an invitation to get registered, and then they can register and then get signed up in there. So as I said, the activation email comes out. Once a contact is created, it'll send out the system automatically. The invitation only lasts for 72 hours. And as you all know from your deal, what it came out as, the email came out from the VPOP, no reply at cdc.gov. Make sure that when you send it out that the people know that. If they're unable to get that and it expires, that person needs to contact the email in the account that's listed in the email in that registration that comes out, and then they'll send them another registration. I can't resend them, or you can't resend them once they've missed that opportunity. All right. So there are user guides in VPOP. In the upper left-hand corner, there's a help menu. There's a bunch of documentation and all the information that you need to use that. We also we'll have this posted, a video on our website to let you guys review this as needed and help answer any questions. There's also support and contact information in the program, and I'll show you that to be able to reach us if you need some help with anything. When you first get your registration, as you guys probably already have, and if you haven't, we ask you to make sure you do activate your account, go in and verify your address, your business hours, and then any licensing information and expiration date. Where it asks for license number, that is your pharmacy license number with the state of North Dakota. And if you fill that in there, if you don't fill that in, you won't be able to receive any allocations. They also ask that we report your inventory every day, and again, I'll show you how to do that in the system. Once you do that, you want to report what you've utilized and how much you have on hand. They're asking you to do that every day. That may change, but for right now, we're doing that every day. The antivirals and the new monoclonal, the Evusheld, is reported in the HPOP system. The BAM, ETA, Regeneron, and Sotro are still reported the same way that you did before. Until they switch over sometime in the future, they're planned on switching over and using this system to allocate them too. So until that time, the reporting will remain the same. Oops, I went the wrong way. There we go. All right, help desk. These are some of the informations that you need, and they'll be out there in your links too. If you have issues logging into HPOP, like you didn't get registered soon enough, things like that, you can email cars_helpdesk@cdc.gov. That's where we go for there. If you forget your password, there's a link on the login screen to go, and they'll get you reorganized with a password. If you have other issues using the portal, it's email hpop@therapeutics.com or at hhs.com, and general program questions are at the other one. You can always reach us either here at my email or through the email that's posted on the support, or you can dial 701-328-0707, and they can always help you with or get you in touch with somebody that can help take care of your problems. So we'll go over a little bit of information about the new therapeutics. Evusheld is in the state at this time. It's being allocated to us on a bi-weekly basis. We allocated it to some of the hospitals. You guys should be getting an allocation here in the next week to help get that out and get there. Paxlovid is also in the state, again on a bi-weekly basis, and it again is being allocated out to the hospitals. And Molnupiravir, that's a mouthful, is also in state, again on a bi-weekly basis, and we will allocate that out if you request and like it or want to use it. So we'll go over some specifics about each of these medications. The Molnupiravir is not for use in patients younger than 18 years old. It's not for treatment of hospitalized patients, not for use longer than 5 days, and not for pre or post-exposure prophylaxis. It's 800 milligrams every 12 hours, so that's 4 200 milligram capsules. Start treatment as soon as possible after a positive test, and make sure you complete the 5-day course. Not recommended for use during pregnancy, and not for patients less than 18 years of age. And this is, so for the pregnancy, you should confirm if they're pregnant or not prior to issuing. And the less than 18 is because it may affect bone and cartilage growth. And also for lactated patients, it's not recommended during treatment or for 4 days after treatment. Paxlovid, not for treatment of hospitalized patients and not for use longer than 5 consecutive days or for pre or post exposures. This dosage is 300 milligrams, 2 tablets of Nimtavir, and sorry about slaughtering these names, and then along with 100 milligrams of Retinavir. They'll take all 3 tablets twice a day for 5 days. Reduce dosage if there's a renal impairment. Start the treatment as soon as possible and complete within 5 days. Not recommended for use in patients with severe renal or hepatic impairment, and it's also if you co-administer with drugs that are dependent on an enzyme in the liver, not to be using it with that. Evusheld is formerly known as AZD 7442. I think they should have left that name, it's a lot easier. The EUA has been issued for this, and it is a long-acting monoclonal antibody. This is for pre-exposure prevention. This is targeted for patients that are immunocompromised and are able to receive vaccines, or for some other reason not to be able to get treatments and such. This would be for patients that were on immunosuppressant drugs from transplants, or have some kind of immunosuppressive disease, or on chemotherapy and cancer. This is an injection, two injections intramuscular, followed one right after the other, and this is good for 6 months and can be repeated after 6 months. Again, I talked about the target population, and that it shouldn't be used in an individual for treatment of COVID. This is not a treatment like the other monoclonal antibodies. This is a specific pre-exposure prophylactic to treat the patients prior to that. All right, and I can talk about the different treatments lead to inadequate immune response. So hematological malignancies, solid tumors, solid organ transplants taking immunosuppressants, and a few others there. All right. This is, so the Minovera and the Paxlovid can be stored at room temperature. They're just medication or pills, tablets. This one, the Evusheld, needs to be stored at the refrigerator temperature, 2 degrees Celsius to 8 degrees Celsius. Needs to be protected from light and must not be frozen or shaken. All right, so that's it there. We'll talk a little bit now about the portals. So here's the logging into the portal. If you haven't logged in yet, or if you did, you know about the 2-factor login. So once you get there, then it'll ask you for the Google login. Let me pull mine up. All right. Ooh, it worked as planned. Good. This is the provider portal. This is what you'll see when you log in. Up here is should be your name, and under Therapeutics, or if you're logging in under your vaccine one, it'll say vaccine here, but it should say the name of your facility. Along the line up here shows what you have. It shows everything, or you can look at your orders that were sent here. Here you can see on 1/5 there was an order sent to the North Dakota warehouse, and that was, once you click on it, it opens it up. It'll tell you Evusheld. We ordered 5 units, 120 total courses, and then it gives our information about who the contact information, where it's to be delivered to, and that. And along this line is more just what the inventory is, and information such as that. All right. If you look over here to the right, this is your provider details. This is where your information goes. Click on the small little pencil over here, and that'll allow you to update your information. Once you update all your information, hit apply change. Okay. In the receiving and address hours, once you click on that, once again, just click on this one. You click on the T on the side here, and nope, sorry. Click on the physical, and it'll bring up a box with information in there. You can update that as needed, and go from there. Down here, you can put your business hours in. We do ask that everybody completes what times are open, or what time they'll be able to receive, and days that they'll receive products at their facility. So when we're able to direct ship to you, they'll be coming by FedEx, UPS, so we need that information. And again, hit apply changes when done. Support information is taking a little time to get working here. To support information, this is who you can contact here for help. If you send an email to dohmab@nd.gov, that'll send an email that's monitored, and we'll get back to you with any questions or concerns that you have. You can also contact the phone number 328-0707, and that phone number is answered 24 hours a day, and they'll be able to get you some help from there. Okay, down here is your contacts. This is where you can add more contacts. If you need to add another contact, you can click on the plus sign here, fill in their email, and then from there it'll ask some more questions, and you can go from there. So let's I'll put mine in. It should bring. Oop, won't let me. It already exists. How could that be? Well, we'll come back. It'll ask information about their email address they'll have, but it'll ask information about telephone numbers and things like that to be able to reach that person. And then just fill in their information, click apply changes, and it'll go through. Over here is where you report under courses administration on the left here is where you report how much you have on hand and how much you and how much you've administered. So I'll do this for today since I know what these are. We have 120 of EvuShield in the warehouse, and we haven't administered anything. We have 560 doses of that and haven't administered anything, and then 0 and 0. Once you have your information entered, if you save therapeutic courses, if you notice under history, it updated to the date. It should have updated to that date. So it updated to the date. You got to refresh. That's what it is. And it did. So that's how you report your courses on hand and that. Transfers. If you have to transfer between facilities, and if you have questions, we'll help you do that. But you can do that, as you can see here, we transfer out. That's how we allocate from our warehouse. You just add a transfer, push the date in, who you're transporting to, what therapeutic, and the number of courses, and hit create, and it'll transfer that over there, and then you can move the product to there. Up on the right hand corner up here, this is our help desk, your feedback, and who's logged in. The help is where your documentation is. As you can see, there's a couple different things you can go to, and you can also give feedback. You can give some ideas how your experience was, and things like that, or ideas of what you would like to see in upcoming updates coming out. I'll give you a quick. Does anybody have any questions on the provider portal?
If you do have a question, just go ahead and unmute your microphone and state your question. So we'll pause for a little bit and see if anybody has any questions you'd like to ask. Well, it doesn't appear that we have any questions coming in, George, so we'll go ahead and proceed.
Give a better explanation.
Excuse me.
Oh, go ahead.
This is Lori Thompson at St. Kateri in Brawler, North Dakota. Just curious on the reporting. I noticed that it was only the 3 new products. Are we supposed to report the current monoclonals on this website or not?
No, the current monoclonals, continue to report the current monoclonals the way you normally did through either HC Standard or through Teletrax. Once these move, sometime in the future, those medications, those monoclonals will move to this process of 2, and when that happens, then we'll report on there. But at this time, continue reporting the current monoclonal antibodies the way you normally do, and only report the new ones in this system.
Okay, thank you.
You bet.
Can you hear me?
Yes.
This is Charlie at Trinity Hospital Pharmacy. I was just checking. We're logged in and we've been updating our courses available, but the history doesn't make it look like we have. Is that a bug in our system, or does it just not show us what we've done?
No. So what happens is that it's in there. The history will update at 5 p.m. when the system updates. I just remembered that. So sorry about that. So it'll show your yesterday's or a previous deal, but it should update at 5 o'clock when the system updates.
It's not telling us anything since December 15th on the one and the 22nd on the other. So it makes it look like we haven't updated it at all.
Okay, let me check on that to make sure, because it is showing the same thing on ours too. So let me check with the HPOP and see why it doesn't seem like it's updating.
Okay, thank you.
I wonder why that is.
Quick question, are you able to hear me?
Yes.
Okay, I just want to make sure I understand. So the HPOP portal is for reporting what we have on hand and what we're administering, but we're not able to order through this portal.
Right, we're still going to do allocations through like we normally do. If you need to order some or get some that like you've already, if you need to order more than your allocation or need to do something, we still go through the Han Assets site at the hanassets.nd.gov, right? Yes. And order through there, and then we'll get in contact with you and work with you to get what you need out to you. And once we do that, then we'll transfer it from the warehouse into your system.
Okay, thank you.
Yep. Sometime in the future, they're going to open this all up and do it just like they did with the vaccine, but they're doing it a step at a time because there's just so many people getting logged in, getting assigned and things like that. So to minimize confusion and to help get everybody up and running, they're doing it a step at a time. So, all right. Any other questions? All right, I'm just going to show you real quick what our portal looks like when I'm from our partner standpoint. So if you look on here, So on here I get a lot of details about all the different providers that we have on here, and I split them up into groups so it's a little easier to function and get in there. Right now we have a total of 387 partners in here. They're not all onboarded yet, but sometime in the future they should be, and we'll have that many to go ahead and work with. I can look in here and look at what's being shipped, what's coming, what has shipped, different information. I can see what your administered and available are. So I can look on here and see what everybody has on hand, what's available, and all and that there. So our thing is a little more information, but more on the front end, and that we'll be able to see back. So there's not a whole lot here. I just thought it'd be nice to let you guys see what I get to see, and that. Two things that we can do on here that you can't do on your guys's. Up along the top, we can put in news and get information out to you that way. We can put update. Where did it go? It's on here. Sorry. But I can put updates. I can pass on information and make sure you guys. So it'll put a little banner up on top of your up along here saying that this is what's going on. If you click on it, it'll give a bigger explanation, and then you can dismiss it. Another thing on this is that the information that you provide, so like if you have what courses how many courses you have on hand, what you have available at your facility, they are developing a website that'll be public facing, so the public will be able to see what you have on hand and where it's available at. If you don't want that, you need to let me know, and I can turn that feature off, and then the public can't see what's out there and stuff. But if you want the public to know and be able to come in and get that information, we'll keep that on there. So those are two things to be aware of that I need to do from my end that you can't do on yours. News, that's down here. So I can put in, as you can see, like on here, here's some of the news that has gone out and then been put out there in that. So, in there. Stupid thing. All right. Well, that's all I wanted to show everybody today and get you all introduced to the HPOP system and let you get in there and see what's going on and let you start working on stuff. I've seen some of you have already filled out the information on there, and that's great. If you have any questions, once again, you can reach the emails on here, or if you contact the 328-0707, that is our operations center. It'll be answered, and you'll be able to, they'll send you to me or somebody else that has some knowledge on what's going on here. I will find out the information on that question about the history and find out why that isn't displaying right, and I'll post that out in the news to make sure everybody gets that information. So thanks everybody, and
Let's just make sure that we've answered all the questions before we close out. And so let's have another opportunity for you to go ahead and unmute your microphone and see what other comment or question you may have for us at this time.
It's Amy in Valley City. I'm curious when you anticipate having the oral medications available in retail pharmacies.
so our next goal starting next week is to start rolling out and getting the pharmacies signed up. So we're going to be working with the Pharmacy Association, with the North Dakota Pharmacy Board, and getting everybody's emails and things like that and contacting them and getting them signed up and rolled out into this. So hopefully by the end of next week or into the week after that, we should be getting the pharmacies lined up. And then after that, it'll be clinics and other medical facilities. And now, so it's a lot of things to bring on. So we're trying to do it in sections.
So we're actually working ahead in terms of getting the registration processes in place in this new HPOP system. But in terms of any projections, George, do you have any current information about when we're actually expecting to start to receive new product coming in?
Oh, so every Monday we'll have new product coming in, and we'll get that allocated out. Right now we're not getting a lot, so we're working to get everybody signed up, and that way, so when the product does get here and we have enough, we'll be able to get that out to them. Is that what you were looking for?
So that was one part of it, and then the other part, we've got a number of pharmaceuticals that are in the hopper, so to speak, that haven't gone through emergency use authorization yet. The trials are still being completed on, and so we expect those new products to be coming out on this format, and so kind of stay tuned to see what else will be coming out in these allocation processes. All right, great questions. Any others or any other comments? Well, it doesn't seem like it. George, when do you think we'll get back together again next?
Oh, so I'm going to send out today. We'll get you guys. We have a meeting every Tuesday, just like this, just to get everybody up to date. Sometimes they're short, sometimes they're long. It depends on what new information comes out. We bring out new information, let everybody know what allocations are out there. Any updates to the system, we let people know that. So that we hold on every Tuesday at 10 o'clock. Expect an invitation to come out for that, so you guys can get on that, and then get updated information as we go along. But that's a once a week, every Tuesday at 10 o'clock.
All right. Well, George, thank you so much for the information. Thank you for attending and your participation and your partnership with this. Really do want to remind you that the way that you'll be joining in the future is the same way that you joined this time. And also that when we hold these meetings, when we hold these informational settings, they are archived. And so if there are people that want to see what was conducted today or any of the other topics that we bring up, the website is health.nd.gov/ET. And so we'll get this information up, this recording up shortly. Thanks for your assistance today, and take care, everyone.